Good morning, guys. Thank you so much, Sam and Anthony, for the opportunity. So basically, I'm just going to dive into this. My name is Leon from Palladium. I think I have several team members here with me, and I hope I'm audible enough.
Yes, I can hear you. Go on.
Yeah. Thank you. So basically, what we've done is we've developed an app called AfyaSTAT. AfyaSTAT is basically built on the CHT platform, and the main function of AfyaSTAT is to support delivery of integrated HIV preventive and treatment services in the community and facilities in Kenya. So AfyaSTAT is interoperable with Kenya EMR, which allows for bidirectional data exchange through the Kenya EMR add-on module. So maybe Kenya EMR is just an electronic medical record that is basically built on OpenMRS. It is so it is basically a flavor of OpenMRS. So we can see this is a situation whereby we have data exchange between AfyaSTAT and Kenya EMR. So the two systems, that is AfyaSTAT and Kenya EMR, have been configured to support HIV testing services, HIV linkage to care and referrals, and contact listing, tracing, and index testing. So basically we have from the, if you could see the screenshots on the slide, we have AfyaSTAT there, and basically we have forms that are on AfyaSTAT, and the providers at the facility level fill in these forms and are able to sync the data or send the data to from the mobile side to the server side, that is the Kenya EMR side. So basically AfyaSTAT, which is on CHT, is being used from the client side, and Kenya EMR is being used on the server side. So maybe Sam, we can jump on to the next slide. So basically what we have been faced with there is how we deploy AfyaSTAT at the facility level on a fully offline environment. So the setup that we have at the facility level is quite unique, because most of the users of the facilities that we support do not have internet. And also it is a more of a distributed setup rather than a centralized setup, whereby you have each single facility as a server at the facility level, unlike other setups whereby you have all of the facilities connecting into or reading from one database. So these single facilities have their servers, that is the Kenya EMR server, seated at the facility level. So one of the major challenges that we've been having is the facilities do not have internet. They only connect over LAN, and it was quite hard for us to have a situation whereby the facilities can use this mobile application. When they go, the users can go out to the community, capture data, then come back again later on and sync the data into the Kenya EMR server or into the server. So we started first of all by having testing it with the browser. We were using Firefox. So they used to connect to the application through the Firefox, enter data, then sync the data later on. So basically this was just using the database of the browser, and the browser database was prone to crashing. It could not hold a large amount of data. And at some point it was just not working for us. So what did we decide to do? We decided to reach out to the community, and we were able to be taken through how to set up a fully functional offline CHT or AfyaSTAT server. So first of all, from the setup that we got from the community, one of the challenges that we had, knowing that this is a mobile app, and knowing I think Android, it's from Android 9 and above, you need a secure connection for an API to send data or for syncing of data. So from Sorry. So what, from the Android perspective, as I was saying, we were getting challenges because for this application to be able to sync data into the server, the connection must be secure. So it had to have an SSL certificate. So from the community, we were able to link up with the community, and we were able to set up using some self-assigned certificates, and we were able to finally be able to set up an offline environment for CHT. So one of the things that really was big help from the community, we were able to introduce an application known as the Pi-hole. So a Pi-hole basically is a DHCP and a DNS server that acts as a DNS server at the facility level that can help you to like resolve local domains. So those were the main challenges that we experienced before we moved on to the community. So maybe we can move to the next slide. So basically, these are just the challenges and the mitigations. So the first one was the facility to set up is fully offline and no access to public DNS. So the introduction of the Pi-hole as the local DNS, it enables for us to host local domains. So you can have a domain, you have procured an SSL certificate with a certain domain, let's say AfyaSTAT.org. Then you can create your own subdomain, facility.afyastat.org, and Pi-hole can be able to resolve to that domain that you've pointed to the IP address of the AfyaSTAT server. So you can be able comfortably to host local domains at the facility level completely offline. So with these SSL certificates and the local domains, we were able to now to create a secure connection that will enable syncing of data from AfyaSTAT to Kenya EMR. So basically, I think I had just to mention this, the way AfyaSTAT and Kenya EMR, they just basically exchange data directly. We really don't use we are not using FHIR or an interoperability layer to exchange data. We have just set up something like a listener that enables listens to any changes or any tasks that are coming in. For example, if a message has been sent, it listens and triggers the movement of data from the AfyaSTAT, which is on CHT, to Kenya EMR. So the next challenge that we faced was that the app required SSL certificates for the data exchange. So we were just able to like get some certificates. So the first certificates that I had mentioned that we got from the community were provided by localip.co. And unfortunately, these certificates usually expire after 3 months. So when we were doing our first setup, it was just a week before they expire, and they expired. And relying on this, you need to wait for them to again renew the certificate so that you can be able to continue. But the mitigation on this was just to register new certificates for the local domains. So basically, we just got some domains, local domains, and registered them and get some SSL certificates. So another thing is that Pi-hole introduced complexities in the managing of applications in the network infrastructure. So basically, this Pi-hole is like something new that is not used on the facility, and it is taking over what the network was. It is now taking over the DHCP and the DNS functions that maybe were being done by a router or switch in the network facility. So basically what we did, we were able to train the users and the partners on the best ways to deploy and set up a Pi-hole so that they can be able to enjoy these other functionalities that come with Pi-hole. And also another challenge was the installation of all applications to support the offline support setup. So basically we were getting into a situation whereby we have so many applications that need to be installed. So at the facility level, this was quite challenging because you need to install Pi-hole, you need to install AfyaSTAT, you need to install Kenya EMR. So this was not working quite well at the facility level on the users. So what we've been able to do is just to develop an Ansible script that has been able to automate the whole installation process. So basically the user just runs the script and they're able to get the installation is done for them using the script from the beginning up to the end.
I'll be brief. So this is basically the story at the facility level. So in March 2021 is when we first started piloting of the AfyaSTAT solution in 2 facilities in Siaya County in Kenya. The pilot gave us an opportunity to test and enhance the application, but mostly the enhancements regarded perfecting the workflow, making sure all the tools for HTS and reports were all included. So at the end of the initial piloting phase, we got feedback that compared to other data sources, the pilot generated HTS data was at parity. That means concordance was high. And for us, the providers gave us the nod to go ahead to deploy this in now the production level. So some of the feedback we got from the service providers at that facility level were that they had improvements in linkages because this particular application was able to handle linkage of HTS much better than the previous application, and that the streamlined workflow made data entry easier and much more amenable to the use by the providers. Please move on to the next slide. Okay, so after the initial pilots, we moved on to go into full production use by a number of our implementing partners. The first of which was located in Siaya County, that is Shinda Tena. And after the initial pilots, by the last quarter, they were able to roll out to additional 39 facilities. That brings their total to 41 facilities actively using AfyaSTAT for seeing clients and also for reporting. In this Q2, January to March, they plan to extend this to additional 20 more facilities. And we've also seen uptake by a few more implementing partners. The next one is CHT Imara. This is in lower eastern Kenya, in Makueni, Machakos counties. And this particular partner has so far deployed 8 facilities, and they've got scale-up plans to go into 10 new by the end of this current Q2. Another exciting implementing partner that we've seen adopt AfyaSTAT is Ampath. It's exciting because their setup is slightly different. They use a centralized EMR. And so far, they've deployed to 3 facilities. They've got scale-up plans to include 10 or more facilities by end of this quarter.